Hello and welcome back to the Political Storm. I'm your host, Sean Storm. I apologize, it's been a few weeks since I posted any new material, but due to personal life, work life, things of that sort, it's gotten a little hectic. I do intend to try to keep posting new material every couple weeks at most, if not weekly. That said, I had a little trouble selecting what new material to cover today. And decided to go with something that's close to my heart and something that I have direct experience in, and that's the medical healthcare field, especially in light of the different solutions put out there, the current push by the government for the health.gov coverage again. That said, today's episode is going to be probably a three-part series, with today's episode focusing on the issues I see with the two major parties' solutions to the healthcare question and issues, and the last two parts are going to be focused on what I think would work. That said, I want to remind everyone that I am a member of the Reform Party, but I am not yet approved by the party for my personal opinions and things like that. So that's what these videos are still at this point. Though the healthcare solutions that I have in mind, I have submitted to the party. They're being reviewed for possible being made part of our party's platform. So with all that said, let's get started. And I'm going to start with the easiest one first. What is the solution that the RNC has come up with for our national healthcare crisis that's been going on for decades? Well, year after year, they keep saying they have a plan, they're going to release a plan, and it's on its way. We all remember the famous speeches by President Trump of what he was going to do and his solutions, and it turned into just a matter of releasing that he is going to make healthcare more visible price-wise. Is going to make transparency required, which, nice step, that's wonderful, and great. Now you can see how much you're being charged for everything, but you still have no way to affect how much you're being charged by everything other than going to somebody else that's only going to charge you a modicum amount less. That's not really a solution. That's like if every car manufacturer raised their prices by $5,000 to $6,500, and you had to select which one was going to raise their price the least. It's still going to cost you a monstrous amount of money, and you have no other recourse because they're all doing it. So no real solution there other than they say they've got one, but for some reason have never released it to anybody. They just keep saying that what the Democratic Party, the DNC, has done is wrong for the country, which I tend to agree with to a degree. So let's go to the DNC's answers. The ACA, which was released by the Obama administration, was an admirable attempt, and people are going to roast me for that comment. I don't care. It was an attempt to bring health care and health insurance to those that didn't have it. Problem is that it raised the cost of health care for people that already had it, reduced benefits for those that were already having health insurance, and raised premiums a ridiculous amount, including the deductibles as well. For those that don't understand, the premiums is the monthly charge that you receive for having health insurance. Think of it like with your car insurance. You have to pay X a month or every 6 months or every year just to be covered. The deductible is how much you have to pay out of pocket before the insurance starts picking up anything, or much of anything, anyway. The reasoning behind this was that, okay, it might cost you a little more upfront, but if more people have access to health care, at the very least, most health care plans cover what's called maintenance health care. That's your yearly checkups, things of that sort, your mammograms, visits of that sort, annual visits, things to maintain your health, are going to be at no charge to you, which is absolutely fabulous. But the problem is that it is well known, and a fact that is constantly shared by the DNC with the public, that the poorest among us, because they don't get regular health care, are the ones that tend to get the sickest the most often. So what good does it do you to have insurance that, okay, it's going to cover you for your first physical that you ever get, but then you find that you have 5 different things wrong with you that you need to be fixed. All of a sudden your insurance isn't going to cover anything. You have to come up with $5,000 because that was about the average deductible of most plans at the time when ACA came out. You had to come up with $5,000 before insurance is going to help you out with anything. They couldn't afford insurance to begin with. Why is it going to help them, or how is it going to help them if now all of a sudden we're saying, okay, you now have to come up with $5,000 before we're going to cover anything that we know is wrong with you now? Because once you start treating a specific illness or a degenerative disease or anything like that, it's no longer maintenance. That becomes treatment. And treatment is specifically not covered by those plans until you meet your deductible. With the repeal of a lot of the ACA, I've seen this personally, and most of the people, for those that don't know, I do work in the revenue cycle of a small rural community facility. It's a critical care facility, 25 beds. And I know a lot of my patients that I work with through my teams and stuff have stated that since the repeals of parts of the ACA have occurred, their premiums have returned not to normal. I don't know any company that ever reduces their prices to what they were previously. But they've reduced the cost of their premiums, and their deductibles have gone down. Mine personally, I was paying during ACA an average of, I want to say almost $450 in insurance premiums per month. No, I take that back. That was per paycheck. So almost $900 per month for premiums. That's just the premiums. My deductible for individual went up to $5,000, and my family deductible went up to $10,000. Before that, it was half of that, literally. It was $2,500 per family member and $10,000 for the family as a whole. Now my deductible is down to $3,000 per person, $6,000 as a family, and my monthly premiums are $289 a month. And we have one of the more premium plans available through my employer because my wife has a degenerative disease that she was born with, and then I have type 2 diabetes myself, things of that sort. So it definitely helped when that happened. So I see what they were trying to do. I applaud that. I think it was rushed through because they didn't want it to be stopped by the RNC in Congress. Now, that said, the solution now everybody wants to turn to is a one-payer system, reminiscent of what we see in a lot of Europe and Canada and things like that. There's a couple reasons why I don't think that will work. My biggest fear, first of all, is knowing how insurance works in the United States and such, and this includes Medicare. If you go down to a one-payer system, what happens when you don't agree with that payer? You have nowhere to go. You can't change carriers. You have no recourse other than complain to the very people that are running that plan. You complain to the government about the government. And we all know how well that works. My other biggest complaint on that front is whenever there are issues, the government is the slowest thing in the world to address it. Take the VA, for example. And I shout out to all veterans out there. It's one of my regrets that I never joined the military. Unfortunately, my personality, I don't take well to other people telling me what to do, so I would have probably been in a lot of trouble if I tried. I'll admit that right out in the open. But the VA, people had known for decades there were issues happening in the VA. Patients not getting the treatments they needed timely. Just things of that sort. The news released conditions of one VA member who was a retired officer, and then also snuck cameras into a VA facility. This is after a good 20, 30 years of people complaining about the VA. Everybody knew it was happening, But only once it was released on the news, then did the government start stepping in. Now veterans have the right to go seek treatments from other facilities and other physicians of their choice if there's not one available close to them that is a VA member, or that the VA is more than X miles away from their home. Luckily for my rural community, that is pretty easy for most to meet, especially the distance aspect. But this is the process people want us to all switch to, and I don't agree with that. Now, why do I think that both parties are doomed to fail in treating our insurance issues, or our healthcare issues, more importantly? Because they only focus on insurance. Our healthcare is a three-part cycle. You have the providers, you have the producers, the people that make medications, big pharma, the ones that make the medical equipment, things of that sort, and the insurance. And all they're doing is focusing on here, but not focusing on these two and what's going on here. And I'm not saying that any one particular part is trying to gouge anybody for money. It's just they all feed off of each other and increase costs. If one raises costs, they all have to raise costs to meet the needs of that one, or the demands of that one. And some going insurance, but big pharma is just as bad, and so are providers. But why are providers a big issue? It's not because they're all making bank. Yes, there are some that go into being a doctor to make a lot of money. Those generally are ones that go to work for-profit organizations. They do super specialties like brain surgery and open heart surgery, that type of thing specifically, or one of the biggest ones, cosmetic surgeons, because they're not covered by insurance for the most part for most procedures, because it's not deemed medically necessary. But the biggest cost for providers is the administration, and I'm considered part of administrative cost, and so is my whole team. So whenever you think of, when I say administration, don't think of the CEO, the CFO, the directors, that type of thing. That's not what we're talking about here. This is all non-medically trained personnel that support those that are medically trained personnel. So this would be housekeeping. This would be the people that do the billing, which, again, that's my department, the ones that do the scheduling. For every provider, and here when I'm saying provider, I am talking about the actual doctors or PAs, things of that sort, people that actually see the patients and treat the patients. They diagnose and treat the patients. For every one of those, on average nationally, and this is from Forbes, there are 8 to 9 administrative staff attached. 8 to 9 people for one person's job. That's where the biggest part of money savings can occur in hospitals. On the big pharma side, again, we already know what's going on there. We have companies that are producing life-saving medications that are charging large amounts of money for it, even though it's been on the market for decades. And neither one of the parties want to address these issues. As a matter of fact, if we went to the one-payer system, the administrative cost part, because it will always get more complicated, will increase. And neither one want to touch big pharma or the medical production companies, because they're the ones that pay for them to be in office. They're the ones that have the huge lobbyists paying them to help keep bills and laws in their favor so they can keep producing at the cost they are. So, with all that said, our next episode is going to start focusing on my 8-step process that I'm looking at that does address each section of that. I'll break it up into 2 parts, 4 pieces in the first one, 4 pieces in the other. Again, it will be my opinion, and I also want to state that I know my plan's not perfect. There are issues. Feel free to argue with them. They're there. I know they're there. But it's better than what's being produced right now. It's more inclusive of the entire problem, and not just focusing on one specific area of it. That said, I hope you have a wonderful day, rest of your week, and do well. I'll talk to you again soon. Thank you.